Hey everyone, I am happy to welcome each and every one of you to today's webinar, where we will be presenting 7 must-track telehealth KPIs and benchmark data for 2023. My name is Brooke. I am a junior marketing coordinator here at Mend. Today, I have the privilege of joining Matt McBride, CEO and co-founder at Mend. Matt, how are you doing today?
Brooke, I'm doing fantastic. It's great to be here, and I think we've got an awesome presentation prepared for everybody today.
I'm excited for this one. Let's go ahead and get into our agenda, which is packed with key metrics and data today. Matt is going to take us through the telemedicine data from Mend's annual report titled Key Performance Indicators and Benchmarks of Successful Telehealth and Patient Engagement Programs, 2023 edition. Finally, we'll round out today's webinar with a Q&A session, and starting now, you can use the Q&A box at the bottom of your Zoom toolbar, and we'll get to as many questions as we can at the end. Let's go ahead and get started. To set the stage for today's presentation, Matt, can you give the audience some high-level stats on Mend so they understand the scale of the benchmark data that will be presented today?
Yeah, absolutely. And I think for today's presentation as well, we might be able to give everybody a little bit of time back at the end to maybe catch up on some other things. We probably won't take the full hour, and we'll have plenty of time for questions. But just to kind of set the stage, as Brooke mentioned, we do around 400,000 video visits per month. We handle a lot of in-person appointments as well. That's across over 5.5 million patients, and tens of thousands of providers. So as we move through the presentation today and take everybody through the key performance indicators and also share some of our benchmark data across the entire platform, we wanted to give everybody a sense of scale in terms of how we're arriving at the data. And so we're talking about touching almost every state in the country except maybe for one, millions and millions of appointments and millions of patients.
Thank you for setting the stage for today's event, Matt. Let's go ahead and get right into the first KPI for today, telehealth no-show rates.
Yeah, so no-show rates is probably one of the most common problems customers come to us with during the sales process, and in terms of setting a goal as we implement and bring them up on the system. It's probably one of the most important problems, and I think one of the best value propositions for telehealth is reducing no-show rates. And so as we look at an average of 23% in the US for a no-show rate, and then of course that varies by specialty, right? Primary care maybe is 18, 19%, behavioral health could be 30% or more, right? So everybody's going to vary there, but considering an average 23% average no-show rate, that's almost 1 in 4, 1 in 5 appointments that you put on the schedule where somebody's not going to attend. And if you compare that with telehealth, and there's actually been national studies published, and our no-show rates are consistent with those national studies, we saw an average no-show rate of 7.4 or 7.5% across Mend in all of 2022. And so I think what that says is if you give people convenience, you save their time, right, from traveling, maybe the inconvenience or stigma or whatever, they don't want to be exposed to other sick people, whatever could potentially be the factor for creating a no-show. If you introduce convenience and then you give them a frictionless way to connect, there's a dramatic improvement in no-show rates. So you're talking maybe 1 in 4 don't attend to now, maybe it's half a person in 10 don't attend. So I think, it's not always applicable to offer telehealth in every situation. It's not always reimbursable to offer telehealth, but I think that's one of the biggest value propositions, right? If you can focus in on those types of appointments where no-show rates are higher and you can leverage telehealth, you can see significant improvements in your business. So definitely a key KPI that we track for customers and that we can report onto our customers as well.
For a 10-doctor practice averaging $74 per visit, a 5% decrease in no-shows would equate to $168,720 per year. Matt, you have some more insights around no-shows. Please take us through these.
Yeah, absolutely. I think Brooke makes a really good point. There's a big ROI on leveraging telehealth, especially if you really focus in on no-shows. So here's some other interesting data points that we wanted to share this year around no-shows. So we've definitely seen improvement across the platform. So we've seen a decrease in no-shows between 2021 and 2022. So from about approximately 9% in 2021 to about 7.5% in 2022. So definitely seeing improvements there. And I think as more people get used to receiving care with this type of technology, it's just become more and more prevalent. I think we're seeing better adoption as a result. But what was kind of interesting is if you take some of the best months versus the worst months. So some of the best months in terms of no-show rates, and you can kind of see that we have a June, July, and January. So you can see how low it was for those months with sort of hovering in the 6% range. So I thought that was interesting, seeing 2 months from the summer being some of the best in terms of no-show rates, specifically for telemedicine, right? Because I think typically we think for an in-person visit, maybe that's not the case. People are summer, vacation. Maybe you would see no-show rates increase during those months, but for telemedicine, sort of the opposite was happening. And then we looked at what were the worst months for no-show rates for telehealth. And we had February, April, and March. Now, still not bad at roughly 8.5%, not bad compared to if an in-person visit, which might be a little closer to 23%. But just thought it was interesting and thought that might be some fun facts to share with the audience today around no-shows.
I know I have personally experienced a wait time when seeing my own doctor, which I am sure everyone joining us today has also experienced at some point. Matt, how does wait time translate to telemedicine visits?
Yeah, so we've actually seen a decrease year over year in telehealth wait times. So it's really tough to find concrete data published online around wait times. You can get some rough averages and you can, see that there's estimates and guesstimates of, somewhere in the 15 to 20 minute range. It's kind of surprising because in a digital setting, you really have access to this data down to the second. So it's surprising that you don't see more people publish this type of data. But our average for 2022 was 10 minutes and 20 seconds. That's down from around 13 and a half minutes from 2021. So we've actually seen wait times improve by a little more than 2 minutes. So that's exciting to see. I think it's also important to say, well, what is a wait time? How does MEND define a wait time? And it's not even necessarily from when the appointment was supposed to happen until the provider connects. So we all joined this event at 2 p.m. Eastern time today, right? If you joined 5 minutes early, the time you joined early is considered a wait time from our perspective. So we don't necessarily look at wait times from the start time. We look at how much time was the patient online before the provider connected. So you could have joined a little bit late. You also could have joined a little bit early, but on average in 2022, we saw 10 minutes and 20 seconds average wait time across the platform.
Matt, so far you have referenced that many organizations on MEND have single-digit no-show rates, and the average patient wait time is roughly 10 minutes. For a quick reference, can you explain the MEND telehealth software?
Yeah, absolutely. And we won't try to make this a big commercial about MEND, but did think it was important to point out that if you do want to see single digit no-show rates, there's things that are important, and there's other data that's important, and other information we're going to share that's important to achieving those types of results. I think that's what our hope is, that today everybody that's attending can learn some of our best practices, as well as we share KPIs and benchmarks. But removing friction to connect to the telehealth visit is going to be very important to achieving those types of results, right? If you have a complicated process, maybe there's an app to download, maybe there's a login, there's a registration, all of these things can create friction, which is going to mean that less visits may actually happen. So I think the more you can create a frictionless experience, and so how we achieve that is we text and email a link. The patient clicks the link, they put in the date of birth, they connect on any device. It's that simple. So we send them a link, they click, date of birth, that's it. It works in any browser, on any device. If they get stuck along the way, we have support that's available within 15 seconds. So we have US-based support team that can help folks connect, and they're available within 15 seconds to provide that support. And so it just has to be effortless, has to be absolutely effortless for the patient. And so that's going to be a key factor in achieving optimal results for any telehealth program.
Connection quality and the ability to function on low bandwidth is important to be able to help more people. What does the connection quality data tell us at MEND?
Yeah, so there's connectivity, I think, is something that everybody hears about or feels. Anybody connected to a telehealth program, there can be some challenges around connectivity. The good news is we're seeing positive trends in bandwidth, seeing bandwidth and whatnot increase across the entire platform. But we're going to show you some other areas of connectivity today, and some other areas that could be causing connection issues. It's not always the actual bandwidth, the actual internet. It could be the complexity of having to connect, not having the right contact on information on file. Maybe it's too cumbersome. There's, software has to be downloaded, installed, all of those types of things. So there's a lot of different things that can affect connectivity, but we're seeing overall improvements in average bandwidth across the entire platform. So we actually saw a 51% increase year over year in the average bandwidth. So on the right side of the screen here, we've got, and try to not get too technical here, we've got everything listed in kilobits per second. So this is the amount of data that is moving back and forth, sort of the average amount of data that's accessible to send and receive video at the same time. And so just to think about it in the most simple of terms, if you've never heard of kilobits per second before, the higher the number, the better, right? So we'll have a Super Bowl coming up here pretty soon. Whoever scores the most points wins, right? So in terms of connection quality, the higher the number, the higher the score is better. So in 2022, we saw bandwidth at almost 700 kilobits per second, where in 2021, the average was a little bit closer to 460. So that's that big year over year improvement. And then we can see from a patient's perspective, the patient average is a little bit lower than the provider average, as you would expect. So you can kind of see we have patients connecting to the platform, we have staff connecting to the platform, we have providers. And so patients and staff may not have the best equipment all the time, may not have the best connectivity, where a provider maybe has a better device, better quality internet, so on and so forth. So you can kind of see that the providers definitely have a slight advantage, and they have a higher number at 860 as compared to staff and patients. Their average bandwidth is a little bit lower, a little bit closer to our 700 average in the 625 and 615 range. But the good news is across the board, we're seeing more bandwidth available, which only helps more visits to happen, improves the quality of the picture, the audio, et cetera.
Matt, with connection quality being such a hot topic for anyone conducting telemedicine visits, let's poll our audience. Rate the quality of your connectivity from your current telehealth platform on a scale of 1 to 5, with 5 being the highest quality. Poll question should be appearing now for everyone, and we'll give you all about a minute to answer. And once everyone is done, I will share the results with all of you, and then we'll move on to KPI number 4. I see just a few more responses coming through. So it looks like on average, most of you are saying that you rate this a 4. Very little of you are saying 1. Matt, what do you think of these ratings here?
Yeah, I think a 4 is probably definitely improvement since, over asking this question, maybe a couple of years ago. It still sounds like there's some room for improvement. And so I think we're going to touch on some information here as we get into some of the other KPIs that really might help improve connectivity for you.
Thank you everyone for participating, and we will continue on with our presentation. Patient satisfaction is extremely important to measure patient experience and loyalty. At Mend, what have we been able to measure around patient satisfaction for telehealth appointments?
Yeah, so in the beginning of our presentation, we touched on this a little bit as we were trying to highlight the scale of Mend to set the stage so that everybody had an idea of how many patients and how many appointments in terms of where we're getting this data. So we touched on some of these numbers here, but satisfaction ratings are key. I think everybody is watching their online reputation. They want to make sure that they've got good reviews, healthy reviews online. That's where a lot of folks are searching for things. They go to Google or Bing or Maps, and they're searching and they're looking at reviews before making their selection. So satisfaction is huge. And so during the pandemic, satisfaction is a key metric that a lot of people wanted to understand, including the government. And so we saw some studies published through the Healthcare Coalition and through the National Library of Medicine that showed, patient satisfaction ratings around the 80% range. I mean, if you blend those two numbers together, you see about 80% of, patient satisfaction for telemedicine visits. On the Mend platform, we have an option. It can be disabled. I think very few customers do disable it, but you can choose to capture satisfaction ratings at the end of a visit. And you can choose if you want to do that for your providers, if you want to understand how they're rating the system. And, it's sometimes that can help us determine maybe if somebody's having an issue as well, if they have a lower rating than the rest of the folks in your organization. And you can choose if you want to capture patient satisfaction ratings as well. So you can sort of choose if you want to toggle those on or off in our platform. But a lot of organizations do turn that on because it's valuable data that they want to have. And so across our entire platform in 2022, we saw 96% patient satisfaction rating and a provider satisfaction rating of 93%. So a very, very strong numbers, and definitely numbers that are better than some of the averages and some of the surveys conducted really during the height of the pandemic when telemedicine was first being adopted. So this is data that we track and we can share with our customers that use our platform.
Matt, the enhanced virtual waiting room experience is extremely unique to Mend and certainly one of a kind and rather different for our audience today. Can you explain this innovative waiting experience that Mend has created?
Yeah, so we touched on a couple slides here. We had the 10.5 minutes of wait time. Okay, and we talked about that is the time that we track from the moment the patient connects to the moment the provider sees them. So that's the total amount of time that they're online. And we want to keep them engaged. That 10 minutes, I mean, that's a significant amount of time. And it's a significant opportunity to provide folks with an experience. And that's why we created the enhanced virtual waiting room experience. So we have lots of educational content, bite-sized educational content, eating healthy, heart health, meditation, other types of content to help folks, be healthy. And we also allow customers to upload their own content, their own custom videos. So if you want to talk about, what you're doing in the community, other services that might be valuable, other parts of the organization, or meet different folks from the organization, whatever content you want to publish, you can also include. So what this does is we have seen a increase in patient satisfaction correlated to providing this type of experience, right? You could just be looking at a box that says waiting to connect, or a white screen that says waiting to connect, or you can have a Netflix type experience while you wait and see educational content. And at the same time, I think what this says is to patients is, oh, this is an organization that cares about my health and well-being. This is an organization that wants me to be healthy. They're providing me with content. They must care about me and my health. And so this is a really unique experience that Mend has, and we can really leverage that 10.5 minute wait time to make sure that you get the highest satisfaction ratings possible from patients.
Matt, I find this one to be very interesting. Reachability seems like a huge opportunity to further reduce no-shows and improve connectivity. Matt, please take us through this data.
Yeah, so we've really refined this number. And I think for folks who are concerned about their connectivity, right? For folks who aren't quite seeing the single digit no-show rates, or maybe you are, but there could still be even more of an opportunity to improve. We have really refined our reachable versus unreachable data in our platform this year. So what we're really looking for is, can we email or text somebody? That's what we're looking for, right? Can we send them a link? We're maybe going to, we're going to do a telemedicine visit. We need to get them a link to connect, right? Or if they're going to do forms, they need a link to connect. So this data specifically is just for telehealth appointments. It's not for all of the other patient engagement tools that we have. And we're looking at, do you have an email or a mobile phone? Okay, so can we reach you? And is that information valid? Has an email bounced back? Have you replied stop? Have you opted out to the email or text? So basically, can we, you may have contact information on file, but we might not actually be able to use it, right? So you're not considered unreachable in that case. So these are actual reachable folks, right? And so our reachability is high at 95.4%, but that's leaving 4.6% on the table. That is significant, right? If that means potentially 4.6% of the time, we cannot get a link to that person. We cannot get reminders and we cannot get links. We don't have a way to contact them. We don't have a way to engage them. And so for a lot of organizations, this is probably affecting other systems that they have. They could have other reminder systems or other things that they're doing, trying to reach out to folks for surveys, what have you. This is the data that we are given from our customers. And so we see 4.6% of the time, there's potentially an issue with not being able to reach the person. So I think this is something you definitely want to look at. This is data you want to drill into and make sure that you have valid contact information on file and that you can indeed get a link. So across the platform, we're seeing the email collection is very high, but there's a gap in mobile numbers. There's a gap in reachability with mobile numbers. And so for our customers, this is data we can track. This is data we can share, and we can share who those unreachable folks are. But definitely an opportunity here to improve no-show rates, but improve connectivity. If you want to be able to rate connectivity a 5, this could be a very important place to look.
Technology can do many wonderful things, but it doesn't always work 100% of the time. Matt, how does MEN track and report on errors?
Yeah, so we record any errors on our system. We make them available appointment by appointment. We also aggregate them up at higher levels to track, is this provider having a higher error rate than normal? Is this organization seeing higher error rates? And then we have a proactive team that will reach out and help sort out those issues. So we track all of this data and we use it so that we can try to provide proactive customer service to make sure that everything is working as it should be and that all of our customers are having an optimal experience. But there's some insights here as we look at the breakdown and errors across patients and providers. And I think, first and foremost, the top errors, are really related to bandwidth. And that's really what the majority when you're talking about errors related to telehealth and telehealth connectivity, we're mainly talking about bandwidth or issues with their internet, right? There certainly could be an issue not being able to reach folks, right? But that's not necessarily what we mean by a telehealth video error. So typically, if there's an error, there's some kind of internet connectivity type of issue, a wireless connection and the signal quality changed, or the connection through wireless got broken for a second, or maybe the device doesn't have access or the capability to upload the video. So that's pretty typical. Those are going to be the most common areas anywhere you go across for patients and providers. I think what's interesting is that then if you drill into it, we see for patients, they're primarily on mobile devices. So 74% of the errors that we see on the patient side are on mobile devices, compared to providers, only 8% of errors can be attributed to a mobile device. So definitely sort of, and I think a lot of us kind of assume this, but most of the time patients are going to be on a mobile device. Mobile device could be cellular connectivity, is definitely going to be wireless type of connectivity. So, depending on how your connectivity looks within your organization, that's something to be mindful of. And then for patients, we see 26% of the time errors are happening on desktop devices, and 80% of the time for providers. So providers clearly are doing visits on their desktops, and desktops, could be a laptop as well. But in a lot of cases, those can actually be hardwired in, or maybe they're on a really good wireless connection. But we see far less patients pursuing that type of connection. They're primarily on their mobile device.
MEND makes it frictionless for patients and providers to connect, but some small percentage of people can still struggle. What is MEND doing with AI to predict future connectivity risk?
Yeah, so this is our final KPI, and we've got some other slides to share before we get into the Q&A here in a few moments. But we have all of the data that we've covered available to our customers, whether that be in our portal or whether that be somebody on the account management side that's providing those reports on a monthly basis, or whatever frequency is determined to be the best. We do have reporting available specific to telehealth connectivity. So again, those folks that, maybe they rated their telehealth connectivity a 2, a 3, a 4, and you want it to be a 5. If you're using MEND, we can give you a lot of information that might better help you pinpoint any connectivity issues that you're having, because it may not be related to actual internet bandwidth. It may be related to reachability. So we actually have reporting that looks at, is the person reachable? Have they done video visits before? What did their past bit rate look like? Was it really low? Was it too low to support a connection, a successful visit? Did they test their connection before? Was that test successful, or did they fail that? Are we seeing engagement and activity in other areas of our platform, right? Are they doing other things successfully on the platform? And so this report is a great report to assess risk of future telehealth appointments. And by far the number one biggest issue or the biggest risk is that reachability, right? If you have an appointment out there and you don't have contact information that allows us to get a link to somebody, the chances of that visit actually happening are extremely poor, right? And what might that do too? Maybe the person calls, I don't have a link. Staff has to get involved. Now go look it up, try to maybe get them a link manually. So you really want to look at those practices that you have in your organization around collecting mobile numbers and email addresses. Ideally, you want to have both on file for everybody to make sure that you're able to get them reminders and then actually get them the link to connect. But we have this reporting that is available to our customers in our portal and helps you get a sense of what types of connectivity risk you may be exposed to in the future. So this is a forward-looking future report. We're looking at future appointments. So there's opportunities to look at this reporting, drill into where you may have some issues and fix it before the appointment actually happens so that you can help more people.
In past webinars, we have covered numerous studies showing that patients want modern conveniences with their healthcare providers. Matt, how is Mend advancing two-way messaging this year?
Yeah, absolutely. Two-way messaging is a big part of our roadmap this year. Whether you want to be able to communicate back and forth with a patient in a HIPAA compliant environment that does not require an app to download, it does not require a login, it does not require a registration to a portal or anything like that. They can simply access it by using a link in their date of birth. We will, of course, text and email them, letting them know that they have a new message. But this is definitely a big part of our roadmap. So we've made it even easier for patients to connect and receive messages and communicate. And then we're going to continue to add new features, a new UI to make it easier for staff to use and for staff to communicate. You can also do messaging visits. So it's possible to, maybe you want to charge just a copay rate, and maybe it's not reimbursable, but for common questions, maybe you just want to charge a simple copay rate, maybe $20, $30, something like that. Have messaging visits available to patients, or maybe you just want to, send them files, lab results, communicate about upcoming appointments, whatever the case may be. Folks are definitely not answering their phone the way that they used to. And so purely relying on phone calls isn't necessarily going to work for the younger generations. And so a lot of our customers expressed an interest in having a two-way messaging. And so similar to how you connect to telehealth, you can now have a secure two-way conversation or an asynchronous visit. And I think maybe one of the best ways to eliminate a no-show is to maybe not have a scheduled appointment at all, to just simply have a visit asynchronously without a scheduled appointment. So I think there's a lot of opportunities, lots more to come on this year at Mend.
Before we get to the Q&A portion of today's event, our audience may or may not know that Mend is a complete patient engagement platform for in-person, virtual, or any type of visit. Matt, can you explain this further for our audience today?
Yeah, so just real quick, just so you know a little bit more about Mend, we have a complete patient engagement platform. So whether that's before, during, or after the visit, if you want to offer patient self-scheduling, appointment reminders across in-person as well as virtual, allow people to make modifications automatically 24/7, 365 to their appointments, all integrated back to your master schedule. We can do digital forms that are integrated back. We can handle payments automatically in a very frictionless mobile digital type of experience. Link, date of birth, make a payment, whether that be before the visit or after. We can, of course, conduct the visit through telemedicine, through our audio video. So we can actually support the encounter itself. And then we can help after the visit as well, whether we're following up with a survey you want completed, maybe a final payment, so on and so forth. So Mend is really a complete patient engagement platform, so you can consolidate vendors, save money, and provide, really one cohesive experience to patients.
If you are looking for more informative content, we keep a library in the resource section of the men.com website. We have a highly attended webinar that is now on demand titled 16 Key Telehealth Learnings to Prepare for Maximum Success in 2023. Simply navigate to men.com, click on resources, and you can access all of our on-demand content there. In our white paper section, we have brand new content titled Patient Payment Trends in Healthcare. For those in our audience interested in this content, just go to men.com, click resources, and then click white papers. Today's webinar has been amazing, but before we jump into the Q&A portion, we want the audience to know it's easy to schedule a personalized demo of the Mend platform. Just go to men.com/demo. And with that, Matt, let's jump into the questions. And as a reminder to our audience, Zoom has the Q&A option in the toolbar to make easier for us to answer your question. Okay. We have an anonymous attendee asking, is this recording going to be available to rewatch?
And yeah, after the event, anybody who registered or attended, we publish the full webinar on our YouTube channel, and then we'll go ahead and get that out to everybody. So yes, we will circulate these materials, and that should arrive by email sometime after the event, either today or tomorrow.
Chrissy is asking, does the enhanced virtual waiting room require more bandwidth on the patient end?
Well, hi, Chrissy. No, the enhanced virtual waiting room does download a video to watch, and it sort of streams. So it's no different than when the provider joins, I have to download that video. So it's not really, going to create any more bandwidth, because as soon as the provider joins, that enhanced virtual waiting room is completely removed. So it's not like I was playing a video and then maybe it can still be going in the background, and I now have to download the provider's video to interact with the provider and have my visit. It gets completely destroyed, completely removed. So it really shouldn't create any connectivity or bandwidth issues for anybody.
Chrissy is also asking, are these KPI reports available in the Mend application? If not, how can organizations get monthly, quarterly updates?
Yeah, most of these metrics that we've discussed today are available in the portal, and I believe they're called Mend metrics. It's either a Mend metrics or metrics dashboard, and so most of the data is in there. And then account managers have access to all of this data and more. So, and that can absolutely be provided on some sort of regular cadence, on a monthly, quarterly basis. And then a lot of those reports, they're a little more visual in nature. They'll show you how you're trending over time. Yes, we do have the data that's available within our website, and our account managers can provide a little bit more elaborate reporting on a regular cadence as well.
Penny would like to know, what talking points or tools do you have that we can share with our providers, staff, to increase engagement and decrease fear?
Let's see. I'm not totally sure I understand the question, Penny. Maybe they are, um, fearful of using technology. Maybe they want to kind of stay in their ways and use in-person visits. If that assumption is incorrect, feel free to ask another question, and we'll try to get that addressed. But I think telehealth can really be used to maybe give providers more flexibility. I mean, we've seen customers that have gone from provider shortages to wait lists for being able to offer telehealth, where maybe providers can work remote or work remote some days. So I think it's really just about finding a win for the providers that sort of improve their quality of life, maybe help with administrative tasks or burnout. We do have some other content that may be helpful in the men.com resources section around burnout and other topics on our blog as well. So we have some ebooks, some webinars, some blogs that may be able to help. So I hope I'm answering the question and interpreting the question okay. If not, feel free to re-ask, Penny.
Cindy is asking, does Men track all of these KPIs for customers to review their own data?
Yes. So, and I saw some other folks have asked this question too. So this is a popular question. Yes, we have them available in the reports, in the portal. There's some reports that roll up around digital forms. There's some that roll up around telehealth called Men Metrics. So we have those available in a portal. If you're having any trouble finding those, you can hit the need help. Somebody within 15 seconds can help you locate those. And then for accounts with account managers, we have more elaborate reports that we can provide as well that really go into a lot of detail, tracking every aspect of the programs that you're running, whether that be telehealth or reminders or forms or payments, et cetera. So yes, all the data is available. If you reach out to your Men point of contact, they can start providing this data to you.
Tom asks, the unreachable data was a little surprising. What do you recommend to correct that?
Yes, the unreachable data, I think you want to make sure you have rock solid processes and controls in place within your organization to make sure that you capture a mobile number and an email address. I mean, you want both, right? Just in case, I mean, somebody could change their phone number, what have you, maybe an email bounces for some reason. You want to have that redundancy. So I think, you want to look across your patients and your future appointments. I think you want to make sure you have, at least one, preferably both, right? And really look to measure that. And we can provide the report so you can measure that, so you can actually see that over time as well. So definitely a big opportunity to improve.
Aaron wants to know, when will you secure messaging platform to be available?
So the two-way secure messaging is available now, and patients can access it with just clicking a link and a date of birth. And we'll notify them that they have a new message through text and email. So it is available now. We have messaging visits as well. We're going to be adding lots of new features and functions to that this year.
Thanks so much, Matt, for answering everyone's questions here today. I believe that now concludes our Q&A portion. I just wanted to thank everyone for tuning in and joining Matt McBride and myself today. It was an honor discussing this with you, Matt, always, and we hope you all tune in again next time.
Thanks, everybody. Have a great day.